Hi again, everyone. Welcome to this evening's session on drafting your personal statement. I'm Dr. Amanda Dye, Executive Director at Beyond Barnard, and I am always excited to talk to hopeful health profession students about aspects of the application process that involve self-expression. Writing is a really big piece of the process, especially in the early stages of the application, and I think it's important to focus on doing what you can to make your writing as strong and evocative as possible as an applicant to these very challenging programs. So today I want to talk about a few things. Firstly, just a little bit about kind of why is this valued, right? I know that it can seem more like maybe just a requirement of the application, but I think that there are real benefits to putting some work into a personal statement, as well as some real challenges that you have to confront in that process. We'll talk a little bit about some methods that I endorse for practicing your generating your ideas for the essay, maybe testing out a few different possibilities for personal statements as you kind of work through your building your application. And then we'll talk a little bit about tips that I like to share to help you present yourself and your experiences as effectively as possible. So to start a little bit with personal statement basics, let's see here. So why are personal statements valuable in these health professions admissions processes especially? Well, there are a lot of applicants, right? And one of the ways that programs can differentiate between them is to read, from applicants' perspectives. I think that the personal statement provides an opportunity for you to communicate a little bit about who you are versus maybe some of the other aspects of the application, like the activities section, where you're going to focus more on things that you have done or are doing. A personal statement is also an opportunity really to convey your depth as a person, your level of maturity, some of these kind of intangibles that these professional programs really do place a high value on. It also can help you to highlight things that are really important to you for admissions officers so that they have a better understanding of the perspective that you might bring to their incoming class. And personal statements are a way to kind of help you express a little bit of your personality in this process that I think can sometimes feel maybe a bit depersonalized. So to keep in mind, a personal statement is an opportunity to share that individual perspective. It's a very important opportunity to do that. It is also intended to be an argument in favor of accepting you to the program. And it is a professional communication, right? It needs to be polished. It needs to be very well considered. It needs to go through multiple drafts, but it also conveys a little bit about who you are as a human. A personal statement is not, very significantly, a complete autobiography. Health professions programs will give you maybe 5,300 characters. That's the limit for MD applications. That is not a long space, so there is no way to be complete about your life, So a complete autobiography is not what we're looking for. We're not looking for a listing in prose of all of your experiences. There is a place elsewhere in the application for that. It's not a space where I would really advocate for explaining things that didn't go well. You really want to focus on the positive. And it's not just, something to check off in the application process. It is a real opportunity for you as an applicant. Some of the things that are really challenging about writing a personal statement are things like, it's uncomfortable. It can feel very vulnerable to write about maybe like the development of a particular professional interest. Maybe you became interested in a career in health professions specifically because of a difficult experience. Of course, writing a personal statement takes a lot of time. It's a time and resource intensive process. Sometimes folks really struggle to decide what they want to write about. And my advice is always to try it multiple ways and evaluate each of those attempts as pieces of writing, in addition to, examples of, sharing your experiences. It can be a challenge to to think about personal statements for health professions programs because a lot of different people are going to be in your audience. Many of them are going to be health professionals, but some of them are going to be administrators who work in admissions offices, or maybe our students, or there are lots of different possibilities. And even, within healthcare professionals, there are many different perspectives represented. Sometimes people really struggle with, kind of making a perfect personal statement, which is maybe not the goal that I would have for all of you. The evaluation of writing is a very subjective process, and so different people can have different reactions to the same piece of writing. And of course, there are things that you have thought about, that you've held with yourself, that you've felt for a really long time, that sometimes are just difficult to put into words, right? They're difficult to get out of your brain and your body, the way that you hold on to them, the way that you feel them, and share them with another person through the medium of English. Some elements of a strong personal statement are, of course, narrative, right? You want a person to want to read the next sentence once they've read one, right? And you want to be able to draw the reader forward. You want to be honest in a personal statement, right? Again, maybe not complete, you're not going to be able to say everything that's true about your candidacy, but the things that you do say should be true. You want to demonstrate that you do have a very well-defined and individualized perspective. You want a personal statement to be revised multiple times so that there are, no errors, everything is flowing well, the reader is engaged, all of that sort of stuff. And bottom line, you want the reader to then decide they need to talk to you in person, right? Getting from application to interview is usually the biggest cut in these application processes, and a personal statement can really help to put an application over the edge into, yes, we're going to decide to interview this candidate. So where do you begin? You start writing. It is, you don't need to know exactly where you're going. You don't need to use everything that you write at the very beginning of this process. If what you start with clearly isn't working, then you can abandon it and try again, right? You want to keep writing, and you want to allow yourself to write when you're writing and not to edit yourself, right? Because that part of the process can come later, especially when you are just beginning to think about a personal statement. It's really important to get as many ideas out there as you possibly can, maybe to develop a few select ideas, and again, to really be evaluating that writing as not just, your personal statement, but as a piece of writing as you go through the process. So with an acknowledgement that it is hard to get started, I want to talk you through a couple of exercises that I really strongly recommend for folks who are, countenancing writing personal statements. We're not going to take time to do these because it's a little difficult to do that in a virtual format. However, I'm going to share these slides with everyone after we put up the recording, so you'll be able to kind of come back to these exercises and use them if you really want to engage on your own time. So the first one is an exercise that I call gathering images. And this is one that I like as a way of just like generating a bunch of different possibilities for maybe kind of an opening or a structure for a personal statement. So what I like to encourage folks to do is to just kind of sit down and write bullet points, not a lot of detail, but just kind of like snapshots, images of things that have to do with your interest in the profession that you're applying for. So these are things, that might be experiences, they might be memories. You just want to get enough down that you can know what you are referring to, and you'll come back to them later. So my examples here are, if I were writing a medical school style personal statement for the actual kind of grad program I did, which was going to a PhD program in linguistics, there are things from my past that I feel like I could talk about in a statement like that. So, academic experiences that were really important to me understanding my intellectual interest in the field. Maybe a specific research interest that aligned really well with the kind of research that I want to do as a graduate student. Aspects of my personal background that are, relevant in a certain sense to why I'm interested in these topics to begin with. And even kind of like the last one is just sort of like a funny story, right? You know, something that's a little bit unusual, right? I'm not saying I would necessarily structure my personal statement around this, but I could consider it, right? I could test it out. So once you have, you know, let's say 4, 5, 6 bullet points, you know, things that you could, you know, images that you could expand upon. Next step is to just choose an item from your list and write about it for 5 minutes, right? Flesh it out a little bit more, develop it. And then, you know, once you do that process, think a little bit about how well does it convey your personality, your motivations and goals, your reasoning for pursuing a specific career path, which is always important in health professions, right? Health professions overlap, right? They're helping professions. They require problem-solving skills and the use of applied science knowledge. All of those things are true of a lot of health professions. So for medicine, for dentistry, for advanced practice nursing, right? What is special about your motivation to pursue that specific profession? And, you know, as you're developing these images, you want to consider how well it expresses that you are ready to begin your professional training. So it's also important to keep in mind, right? An individual image might not address all of them, but a combination of one or two could help. And the more you do this, right, the more you kind of start with a really basic idea, flesh it out a little bit, and then start thinking about it in context, the more you can see a personal statement start to kind of take shape. Second exercise that I really recommend is to think about skills and personal attributes you know, a healthcare professional of the kind you want to be should have. I invite you all to like pop into the chat, you know, words, phrases, things that you would associate with the kind of healthcare professional that you want to be, maybe things that are related to mentors, you know, things that you've observed in your clinical experiences. What are qualities and characteristics that you think are important for healthcare practitioners? You can use the chat or, you know, raise a hand. These are great, empathetic, compassionate, willing to grow, yes, learning from experiences, understanding, yes. Got a lot of empaths in the room. All right, yes, these are all fantastic. You can continue to add, of course, to the chat as we go on. And I mean, for those of you who are thinking things and not putting them in the chat, you know, things that you really heavily associate with your professional paths, those are things that you might want to consider for the next step, which is to make an attribute map. So what you do basically is you kind of choose one of the skills or attributes on your list, right? They could be one of these that we have here. They could also be, you know, things that you're kind of coming up with on your own. And you want to connect it to a significant experience or a situation maybe that either, you know, that you listed in that first exercise, or maybe something that like is an experience that you've had that you know you're going to talk about in your activity section of the applications, et cetera. And you want to try to think of connections between experiences and attributes. So I'm going to show you an example. There are oftentimes things that are really unexpected here. So in the ovals are these are competencies from the AAMC, right? So these are some of the core competencies for entering medical students, and the boxes are like specific experiences, right? And so for a particular student, there might be a lot of different connections that you didn't even realize. And right, something like being a policy reporter at a student newspaper or another publication is actually really connected to a lot of important competencies for applying to professional programs. So things that you might not notice or might not have initially assumed were really central to your development could actually be really arguable as very central in an exercise like this. So when you do something like making an attribute map, one of the things you want to pay attention to is, hey, is there anything in particular that jumps out at me as, you know, unexpected? What are the activities that I'm seeing the most connections with? And are those kind of fertile grounds for more investigation, more development of particular writing? And of course, were there, you know, connections that you hadn't previously thought about, right? Are there ways maybe that you could talk about particular experiences that haven't been the ways that you've talked about them always in the past, but might be productive for the purpose of your application. So, like I said, I'll share the slides here so that you all can try those activities on your own. And I really do recommend them for folks who are in that idea generation space, especially. The next thing that I want to talk about is how to use the different spaces in your application effectively. I find that this is something that really helps contextualize what we're trying to do with the personal statement versus other aspects of the application. So I like to talk about, the different spaces that you're going to have access to, because it's important to think about how you're going to communicate with admissions committees, right? And you want to think about, of course, the pieces of information that you want to share with those folks, as well as the best places to put that information in your application. There are kind of four main sources of verbal or written communication between applicants and professional programs. Personal statement, which obviously we're talking about today, an experiences or work and activity section where you list a lot of your previous experience and typically are asked to describe it in maybe a short paragraph. Secondary applications, which are school-specific supplemental applications. They are sent to most applicants at most medical programs. For those out there who are applying to dental schools, it's spottier. Dental schools don't all use secondary applications, but for medical applications, they are very, very standard. And then, of course, interviews. Interviews are a place where you can retread some of the information that you have shared in the past and also potentially share new and developing information over the course of your application cycle. My very strong advice is that these different sections of the application should be doing different but complementary things, right? You're not repeating information across all of these. You may be talking about similar experiences in multiple places, but you're not repeating the exact same information. So I want to talk a little bit about how I see these spaces best used to help you kind of think through what is going to fit best in the personal statement space. So we've talked about personal statements for the past 20 minutes. And again, I want to emphasize, this is about developing a narrative, right? This is telling a story. This is really providing more insight into who you are humanly. And it really prioritizes your perspective and reflection on your experiences rather than providing information about your experiences to the reader. By contrast, the work and activity section, sometimes called experiences, called different things in different applications, but essentially that section is where the core information about how you've been spending your time is going to show up. That's the place where you're going to give activity-specific details. You're going to dive into kind of the nuts and bolts of specific experiences and connect those experiences individually to your application overall. A secondary application is going to give you the opportunity to answer very specific questions that are prioritized by that school. They may allow you to provide additional context about individual experiences or kind of about yourself, depending on what the questions are. And secondary applications typically are an opportunity to build more robustly on information that you've introduced elsewhere. Finally, interviews are not necessarily intended for the primary purpose of gathering new information, although that definitely can be a piece of it, especially things that are developing over the course of your application year. Instead, interviews are really important for evaluating your spoken communication skills and self-presentation rather than written communication, right? They want to be able to evaluate both of those things, and interviews are really key for that. And like the personal statement, the interview is also an opportunity to really highlight the person behind the application. And that's another really, really crucial aspect of the importance of interviews in the process. So with that all in mind, when you're building a personal statement, think about a few things. First of all, in the space that you have, which is not long, consider if the information actually fits, right? Is this information that you can get into the limited space that you have in a way that's complete, that's understandable to the reader. Also, related to that, you want to think about what information you share elsewhere, right? Are you repeating things that are maybe in a description of an experience? And if so, can you take that out and use that space better for something else in a personal statement? And finally, you want to think about how well the writing represents your voice and your perspective. None of this happens in a vacuum, right? So your ideas are one thing, but the actual execution of those ideas and how well that execution aligns with the way that you express yourself more generally as a person, these are different questions and things that you do need to evaluate as you're building your essay. I also always like to say this. I think that it's important to remember that just because something isn't featured in your personal statement does not mean that it isn't important. You're going to share a lot of important information that just physically cannot fit in 5,300 characters with spaces, right? And admissions committees are going to be looking for details about your application in all of these, all of these sources of information. All of the various sections of the application are important to them. And so you don't need to feel the burden of fitting everything into this one single section. It's important, as you're maybe considering different options for what you want to put in a personal statement, to include the context that is necessary for the reader, right? And I say this because sometimes in writing about our personal experiences, we get used to saying things a particular way. We have a way that we tell stories about ourselves, or, especially things that are very closely held, like professional aspirations that maybe many of you have had for a long time. And sometimes it's easy for us to kind of skip over some of the stuff that happened in the middle. I think it's really important that, as you're writing, you have folks who don't know all of your stories read and help you recognize spaces where maybe there's some missing information. Because ultimately, whatever you write about, the reader needs to be able to understand why it's important and why it's relevant to your readiness for the professional program that you're trying to enter. And so your writing is going to have the greatest impact if you are able to successfully include the context that is necessary for a person who isn't in your own mind to understand it. And that's a hard process. It can take some time to get language that feels right in expressing some of these things that you are, that you're really comfortable sharing in other formats. This means you might not be able to include all of the details that you'd like to share. Many of you are going to ask me for comments on drafts of personal statements, and probably I'm going to say to all of you that you're going to have to get rid of some of the storytelling, get rid of some of the details, because it's not necessarily central to the point, and it may take up too much space, right? So you might not be able to tell this story exactly the way that you prefer to. It's also important to keep in mind, especially if you're reflecting on experiences that have happened over time, that a linear or chronological presentation of events is not always the best one, right? I mean by that, you don't have to start at the beginning in order to tell your story, right? We're less interested as readers of personal statements in where you started, with your professional aspirations, with your exploration, et cetera, et cetera. We're much more interested in where you are now. And so if writing about, your earliest ambitions to attend medical school is not really representative of where you are now, probably that's not something that actually needs to be in the personal statement. And finally, this is a hard process. Self-evaluation, writing about yourself, I mean, it gets easier the more you do it, but it is hard. And I always encourage folks to really invest in this process, to really, really put the work into it, because I have seen again and again that committing to a process of self-evaluation, of really trying different approaches to writing, and really being willing to engage here is helpful for applicants as they develop answers for interviews, as they develop a better sense of the overall narrative that they want to bring to their application. So it's hard work, but it is worth it. And finally, I want to close my part of the presentation just by talking about some more practical tips on various kind of aspects of development of personal statements. So the first thing that I say, and I say this over and over to many people, is that unique is not necessarily the best approach. What I mean by that is sometimes I have, I've seen personal statements where people are really focusing on an experience that maybe is like a little bit marginally related to their professional readiness, but is unusual, right? And I think that it's a mistake to focus on experiences or kind of personal characteristics just because they are maybe unusual in the pre-health population or unusual in whatever comparisons that you want to use. And partly that's because honestly, there are a lot of applicants in these processes, and it's not safe to assume that you are the only person for whom X is true in the vast majority of cases. I worked in medical admissions, and I saw extraordinary things multiple times in my applicant pool in the same year. I think that it's also important to keep this in mind because applicants have a lot of experiences that share some similarities, right? Many of you have probably heard me talk about this, in pre-health overviews or other settings. The overall contours of an application to health professions programs, they're going to have some similarities across candidates, right? Most people have engaged in volunteer or work experiences in clinical settings. Most people have community service experience. Research experience is very common, especially for applicants to medical school, right? So those kind of big categories tend to be pretty similar from applicant to applicant. But the details are different. And what you take away from those experiences is entirely individual. So even if you're writing about a research experience and it's an experience that you don't think is entirely dissimilar from that of many other applicants, that could be true. But it's also going to be true that nobody else has had that experience from your perspective. Nobody else has learned exactly what you've learned from that experience. So it is my very, very fervent belief that it is best to try to produce a unique application by clearly describing the impact your experiences have had on you in your writing, right? Really focusing on your internal development, your personal learning, your perspective development, all of that sort of stuff is the most important thing rather than simple unusualness. It's also important to try to avoid cliches, right? And again, this can feel difficult because on the surface, a lot of people share similar motivations, right? I expect that everyone who is on this call is interested in helping other people. I expect that you all like applying sciences and solving problems, right? And on the surface, people share a lot of similar interests and motivations, right? Probably more than one of you has been interested in a career in healthcare because of experiences of illness that you've had or a close family member has had, right? And these surface level things, it's not uncommon for those to be similar across candidates. But I find that cliches are a lot harder to avoid if you're thinking about a personal statement or any other aspect of your application in a very general way. Whereas if, again, you are focusing on what did this experience do for you? How did this experience help you learn, grow, change? That is a lot easier to personalize. That is a lot easier to make very specific and distinctive from other folks who have maybe had similar experiences or interests, right? So it's really important to remind yourself, as you're writing, that what you want to draw out is not just the information about, what it is that you're talking about. It's to interpret that information for the reader to help them understand what they need to know about you. I, along those same lines, really advocate for trying to show versus specifically telling things, and I'll talk a little bit about how I mean that in this slide. So avoiding, blanket statements, right? Really trying to keep it as specific as possible, and thinking about how your experiences particularly inform your goals. So again, how have you grown through experiences? How has your perspective on the profession changed and developed over time? You can allow your experiences to speak for you if you're talking in really particular terms about what you have gained from them, right? So instead of doing something like saying, hey, I care about working with underserved populations, writing about an experience where you are already doing that work is a way to communicate your care, but in a much more specific way, in a way that helps the reader understand, what do you mean by underserved? What kinds of care have you shown, et cetera, right? And so I think trying to think about how you can present things in a way that is descriptive of your specific contributions and experience is a really important thing for this process. I also very strongly encourage you not to use words that you would not normally use. I know that sometimes it can be, it can feel like you want to, put in some extra fancy words. I really do advocate for personal statement writing to sound like polished, but natural speech. If you're using unusual vocabulary, it can actually be very distracting to a reader. For some people, really off-putting. And so, if it's if it's sort of sticking out among the rest of your writing, it can be a stumbling point for a reader. Remember that you want your writing to present you as a professional person, but not necessarily a stuffy one. Remember that healthcare professionals do have to talk about complex topics, but they also need to be able to communicate with non-specialists about those topics. And so highly specialized vocabulary is not the only or best way to communicate these things. With that in mind, I encourage you to minimize like medical jargon and abbreviations, just because not all of your readers are going to be physicians, and even among or dentists or whatever profession. And among those who are, they're not all going to be specialists maybe in an area that you're talking about. When you are in your revision process, and I do have another session coming up where we'll talk in much more detail about revision, but I want to say, as you're going through your rounds of drafts, make sure that you're revising and reading for tone. You want people who know you for this evaluation. You want folks to tell you whether your voice comes across. You also really should take care with writing about negative experiences. I don't think that it's wrong to do that. And negative experiences within the healthcare system, for example, can be really strong motivators. So there's probably at least one person among you who maybe has a parent whose first language is not English, and they have struggled to communicate with healthcare providers because providers don't speak the language that's most comfortable for your parent, your grandparent, someone else who's close to you. That kind of a negative experience can actually be a very positive motivation for people who are interested in entering a health profession. But you want to focus on it as a positive motivation rather than, criticizing or complaining, right? There's a difference between describing a problem that you are uniquely positioned to address and complaining about that problem. And finally, remember to keep it realistic, right? Avoid being overconfident. You are at the beginning of your career, and you are asking, by applying to a health professions program, to be trained as a healthcare provider. So you want to make sure that you're showing humility in, your approach to writing about the profession at this stage. Unrelated, related kind of topic, I always encourage folks to take really great care when writing about patients. I think, again, encounters that you have had with patients in healthcare settings may be very, very important motivations to you, and it is not wrong to use those in writing personal statements, but you want to do so as respectfully as possible. So using non-identifiable pseudonyms, you can use initials, you can, just sort of give somebody a whatever, it doesn't matter, as long as you're not using their actual name. And sharing only the details that you need to make your point. You don't need to go into like very salacious detail about the person's condition or like how they presented or anything like that, if you don't need that to illustrate the thing that you're trying to talk about. I'm also very conscious of the way that descriptive language can be interpreted. So I really, really encourage you to review your use of adjectives when writing about patients, to avoid anything that might appear judgmental or condescending in any way. And finally, and I think this is probably the most important, is if you're writing about experiences you've had interacting with patients, or people that you've met through community service, or whatever it is, I encourage you to do so from a place of acknowledging what you learned from that person rather than focusing on what you did for them. I think that is a way that can help you ensure that you are writing about these kinds of experiences humbly and with respect for the people who have helped you learn, essentially. If you're considering writing about your own medical history, again, very common motivator for many folks, not wrong to do, but it's protected information, right? In an application process, no one has a right to know anything about your medical history. So if that is something that you want to include, I encourage you to try it different ways and to use only the details that you really need in order to make your point. So that might mean you don't have to be very specific about a particular diagnosis. You might focus on a particular symptom, right? Or you might focus on your experience in an inpatient setting without focusing on exactly what was going on or why you were there, et cetera, et cetera. You really do want to be careful in considering how much you want admissions committees to know about your health history, because you want to be careful about what anybody knows about your health history, basically. And I think I've said this before, but it's really important to take your time. So one of the main reasons that we ask for a draft or an outline of a personal statement as part of the committee application is that I really want everyone, by the end of this month, to have at least started thinking about possibilities. Because I know that strong personal statements take a lot of time, they take multiple rounds of revisions, and because, as I said before, I think the process of committing to caring about this writing is so helpful for the development of your application overall. I really do want to encourage you to not see it as a chore, but to see it as an opportunity to think these things through. Be open to exploring new ideas. I've said it several times, but try it different ways. If a couple of different ideas present themselves to you, try them out. And, you kind of have to see the proof in the actual writing in order to decide what's going to be most effective. Let go of language that you're comfortable with in favor of language that is clear and accessible to the reader. And if you end up somewhere other than where you thought you were going to at the start of the process, that's not a bad thing, right? That can often be a gateway to really, really excellent personal statement. So with all of that said, I just want to quickly plug that I have a couple of other writing workshops that will come up later this spring, in addition to some other events for applicants to professional programs. Going to do a workshop about revising a personal statement in February. So at that point, we'll talk about, when you have a draft, how do you evaluate it? What are techniques for testing out whether this is the direction that you want to go, or for strengthening the writing itself. And in March, I'm going to have a session on writing about experiences. So as much as we do place a lot of emphasis on the personal statement because it's the longest single piece of writing in the application, the smaller pieces of writing that you do about your individual experiences are also incredibly significant. As I discussed earlier, I think that section can very effectively complement the personal statement, and so I really do like to focus on it, and I will talk with you all about best practices for using that experiences or work and activity section to your advantage. And with that, I'm going to stop sharing and come to see if there are questions. You're welcome to pop questions into the chat. We've got a couple that came to me directly. So you can add to that or use the hand raise thing. I'm going to read the first one, which is asking me if I would advise students to write more about why medicine slash physician rather than why a certain specialty within medicine, because this person is interested in a career in medicine because of their interest in women's health, but wasn't sure if they should mention the interest. So I think that you do not need to be committed to a specific specialty in order to have a very effective personal statement. And that's not an expectation of health professions programs, right? They know that part of the project of going to medical school, for example, is exposing you to lots of different specialties and helping you to choose one that best aligns with your goals once you have had very direct experience with it. So I wouldn't say that there's any expectation that you do this. However, it's definitely not uncommon, especially at Barnard, believe it or not, for people to be drawn to a career in medicine because they care about women's health. What I would say to that is, number one, women's health doesn't necessarily mean that you become an OB-GYN, right? We need women rheumatologists who care about women's health as it applies to the diseases and the systems that they are experts in, right? And so you can still talk about experiences maybe that align with something like reproductive health, but you can frame them as opportunities to engage with a specific population that you know you want to serve in your lifetime, even if you don't end up serving them as an obstetrician gynecologist, right? So I think there are a lot of different approaches here. I do think that it is most important that you articulate why the profession more generally within a personal statement rather than a specialty overall. But I've seen different approaches to this. And there's another question about how much of the personal statement are we expected to have drafted or outlined by the Jan 29th deadline? Any of it that you possibly can, right? So it can genuinely just be an outline with bullet points. It can be some prose. It can be a mix of the two. Genuinely, I just want everyone to have been thinking about possible approaches by next week. Next question is, are admissions committees looking for narratives from more recent rather than early experiences, for example, high school experiences? I will say that in my experience, most admissions committees are looking to get information about experiences that you've had following your high school graduation. So, more recent experiences are typical for something like the activity section of your application, right? Typically, you're going to be including things that have happened since you graduated from high school. Could you mention an earlier experience in a personal statement by way of signaling, kind of where your interest began? Sure, but as I said earlier, where you started is not necessarily indicative of where you are right now. And what's most important is that your personal statement expresses where you are right now. I have another question. Is it hurtful to our application or personal statement to focus on a specific specialty? I think not necessarily. The issue that you run into basically is that that medical schools know that you might change your mind, right? So they're simply just not as interested in your particular specialty interest because they actually they collect data on this. There's an entering student questionnaire, there's a graduating student questionnaire, and they track for every specialty, what's the percentage of change over time? How many people say, that they are going to do pediatrics, and then how many people actually match into pediatrics. And so for medical schools, it's it can be that's nice that you have a specific interest in a specialty, but they also know that you haven't gone to medical school, you haven't been exposed to it in the way that they're going to expose you to it, and again, that you could change your mind. So I think not necessarily explicitly harmful, just not really necessary. Again, though, if there is something about a particular specialty that you're drawn to that maybe isn't the specialty itself, but is related maybe to a population or a kind of work that you want to do with patients, you can frame it that way, right? So really focusing on the actual work that you want to do versus focusing on a particular specialty. If we're talking about a situation where the inspiration was to enter a career in medicine was a beloved grandparent's battle with cancer, all of your research is cancer related, that is a thing that you're committed to, I don't think there's harm in saying that in a personal statement. Again, I just think that there's not an expectation that you do. Next question is, how helpful or harmful are metaphors for successful applications? At what point does a metaphor become too extended in an essay? I think the vast majority of a personal statement really needs to be you unpacking, whatever story you tell, right? So a very common structure is to kind of like open with an anecdote, or maybe to open with a metaphor or something like that. You want to present that as concisely as possible, and then spend the rest of the essay really helping the reader understand the relevance of telling that story, the relevance of using that metaphor for assessing your readiness to enter your professional program. I personally don't, like, my personal taste is not toward, heavily metaphoric personal statements. But again, evaluation of writing is subjective. Other people might respond to it differently. I think that it's hard to talk about these things in super abstract terms. It's much more important that, like, if there is a metaphor that you've been using with yourself, for example, which happens, I do this, with myself, not about going to medical school because I don't want to do that, but other things. And I think I would encourage you to try it, right? To put it down on paper and then, get some eyes on it. Take a little bit of distance from it yourself and then come back to it and really try to evaluate, okay, like, am I communicating, things about my understanding of and my readiness for a profession, or am I, kind of spending a lot of space extending a metaphor? So yeah, I think it's important to see it in its actual written form to evaluate it. And we have another question. Aside from trying to express why medicine, how is this personal statement different from the college application in terms of writing style and professionalism? Well, I don't think you can separate trying to express why medicine from the point of the personal statement here, and from the difference between a college essay and a professional school essay. So at the college level, you are here at Barnard, right? So you are a person who's applied for a liberal arts program, which is not tied to a specific career in any, real way. It's a kind of education. You're coming to a program that, is designed to train you for a lot of different possible outcomes. Whereas if you're applying to medical school, you are applying for a program that is going to train you for one very specific outcome. The vast, vast majority of people who finish that program are going to have the same outcome, which is licensure and practice as a medical doctor, licensure and practice as a dentist, et cetera, et cetera. So the field is narrower, right? We're not interested in kind of knowing anything about you and your curiosity and in the whole universe of you. We're interested in understanding your engagement with, your interest in, your readiness for the specific kind of professional training path that you are trying to enter. And so I think of this as actually like there are a lot more guardrails, right? There's a lot more for you to consider, very specifically to your professional interests in writing a personal statement for a professional school application than the very wide world of possibilities for a medical school application. We have another question about how would I say that you can balance writing a personal statement that stands out while avoiding writing a statement that is not cliche or stuffy. So I think this goes back to what I was saying in the slides about kind of uniqueness. I think that it's really important that your writing is authentic to your experiences, and that your writing shows that you have done careful self-evaluation. What stands out to me as a reader is when I can tell that someone has genuinely interrogated their goals and has real evidence to support the assertion that they're ready for the kind of professional training that they're applying for. I am a lot less interested in, the uniqueness of the experiences that they've had. I'm much more interested in how well the writing expresses individual personal perspective. That's the last question that I see in the chat as of now. Last call, I suppose. Thank you for these really good questions. I really appreciate your engagement. Really, really grateful that you all came to hang out for a little while this evening. For those of you who are planning to apply to professional programs this summer, remember, committee application deadline is next week. If you think you want to apply to professional programs and you haven't been hearing about the committee process, maybe email me and we'll talk about it. Really, again, appreciate you all. Good luck as you are continuing your writing. I know it's not easy, but it is really valuable. So take that with you when you're doing the hard stuff. Thanks everybody very much. Enjoy the rest of your evening and I'll see you later. Bye.